Euthanasia, a choice against life. Imagine enduring unimaginable pain day after day with no hope of recovery. Would you choose to continue suffering? As medical technology advances, society faces the miracle of saving lives and the moral dilemma of ending them. One such controversial topic is euthanasia, the act of intentionally ending a life to relieve suffering. Euthanasia came from the Greek word in the 17th century, which means well dead, has sparked debates around the world which talks about the legality, compassion, and morality. Although some argue that euthanasia provides a merciful escape from pain, however, it ultimately conflicts with the fundamental role of medicine, which is to treat and protect life. Thus, euthanasia should not be legalized because it undermines the sanctity of life, threatens the ethical foundations of medical practice, and provide a dangerous risk to vulnerable individuals. Life is sacred and should be protected at all costs, no matter the circumstances is. From a moral standpoint, taking a life intentionally violates the fundamental principle found in the sixth commandment, thou shalt not kill. Many religious and ethical traditions worldwide emphasize that every human life carries inherent dignity and worth. Permitting euthanasia sends a message that some lives are less valuable than others when suffering becomes overwhelming. If society accepts that ending a life is an acceptable solution to pain or disability, it becomes easier to justify euthanasia in broader, more questionable circumstances. Thus, the legalization of euthanasia would dangerously erode the respect and value we place on human life itself. Another significant issue with euthanasia is how it threatens the integrity of the medical profession. Doctors are sworn to preserve life through the Hippocratic Oath and ethical codes not to end it. Although they are not obliged to perform euthanasia, even referring a patient to another doctor creates a moral conflict between upholding life and fulfilling patients' requests.
Euthanasia fundamentally shifts the role of medical practitioners from healers to life enders. This would undermine the confidence that patients have in doctors, and people may question if medical advice is genuinely aimed at hurrying death or healing. To maintain the trust between doctors and the society they serve, clear boundaries must be upheld, and euthanasia must remain outside the scope of medical practice. Legalizing euthanasia also poses a danger to the most vulnerable members of society. Elderly individuals, people with disabilities, and those suffering from terminal illness may feel pressured to end their lives, not necessarily out of the personal desire, but because they fear becoming a burden to their families. Statistics shows that 6 out of 10 people consider euthanasia primarily due to financial strain and emotional exhaustion. Not just unbearable pain, non-voluntarily takes place when the permission of the patient is unavailable, particularly in cases involving patients who are in a state of coma or instances with babies are born with significant congenital disabilities. This exposes people to decisions made without their consent and eliminates the crucial component of consent. Euthanasia is not merely a personal choice. It can become a societal expectation, endangering those who most need protection and care. In conclusion, euthanasia may appear to be a compassionate option. Still, its legalization would deeply harm our moral values, the safety of society's most vulnerable members, and the trustworthiness of medical professionals. This is sacred and must be treated with the utmost respect, even in the face of suffering. As Saunders of New Zealand says, that they are not be free to do things which limits or violate a reasonable freedom of others. Pain does not diminish a person's worth, and it should never become a reason to end a life prematurely. Instead of choosing death as a solution, let us continue to advocate for compassion, care, and the unwavering protection of life.